Shoulder dislocations, man, they're a big deal. They're pretty common, But which type is most frequent?
Interior dislocations, those account for 95 to 97% of cases.
Wow, that's a lot. Seriously. What causes them then?
Usually some kind of trauma, involving abduction, external rotation, and extension. Think falls or direct impacts.
Right. And what are the common associated injuries?
Well, you got your Bankart lesions, Hill-Sachs defects, and sometimes axillary nerve injuries or rotator cuff tears.
Okay, let's focus on those Bankart lesions. What exactly are they?
They're anterior labral tears. About 90% of traumatic anterior dislocations have them.
I see. And Hill-Sachs defects?
Those are posterolateral humeral head impaction fractures. We're talking about 80% of cases, roughly.
So, yeah, significant damage is possible. What about the nerve and rotator cuff stuff? Axillary nerve injuries, those occur in about 5% of cases. Rotator cuff tears are more common in older patients, though, 30 to 80% in those over 40.
Okay, let's switch gears to posterior dislocations. Much less common, right?
That's right, only 2 to 4% of cases.
What usually causes those?
Often seizures, electrocution, or direct anterior impacts. It's a bit different.
And the associated injuries?
Reverse Hill-Sachs lesions, posterior labral tears, and sometimes humeral surgical neck fractures. Yeah, diagnosing these can be tricky.
What about inferior dislocations? How often do those happen?
Very rare, less than 1%. They're also called luxatio erecta.
Huh. How do they happen?
Hyperabduction or axial loading forces the humerus downward.
And the risk involved?
Axillary artery and nerve injuries are a major concern. Rotator cuff tears and capsular damage are also possible.
So how do you diagnose these different types of dislocations?
Well, the mechanism of injury is important. The physical exam and imaging like X-rays or CT scans are key.
Makes sense. And the treatment?
Reduction techniques vary depending on the type of dislocation. After reduction, we check for neurovalvular compromise and other injuries.
Right. What about recurrence rates?
They're high, especially in young athletes with anterior instability, often need surgery.
What's the main takeaway for healthcare providers?
Prompt recognition and management are crucial. Knowing the different types and their associated injuries is vital.
Any specific advice for managing these cases?
Accurate diagnosis is paramount. You have to use the appropriate reduction techniques, and post-reduction assessment is essential.
Okay. What about long-term management?
It depends on the patient and the severity of the injury. Surgical stabilization may be necessary in some cases.
Are there any specific patient populations we should be extra careful with?
Yes, young athletes are at higher risk of recurrence. Older patients may have more associated injuries.
Makes sense. What about preventative measures?
Strengthening the shoulder muscles can help prevent dislocations. Proper training techniques in sports are also important.
So understanding the different types of shoulder dislocations is critical for effective treatment.
Absolutely. Early diagnosis and appropriate management are key to minimizing complications and improving patient outcomes.
That was a great discussion. Thank you.